them down here to this x-ray room, put them on the table, we numb their groin, either the right or the left, or go through their arm depending on the situation. And we put a small tube in the leg artery, and that gives us access to the circulation. Through that tube we put longer tubes called catheters, and they can go up the femoral artery, up the aorta, around the arch, right in, and we take what's called an angiogram, and you can see the tube here is in this artery, and we're injecting dye into this coronary artery, and you can see where the blood's flowing. If there's a blockage, we'll see that the blood is not flowing in that direction. And if it is a heart attack with a totally clogged artery, we're able to put a thin wire, beyond the blockage into the distal part of the artery, and then advance the balloon to where that blockage is, blow up the balloon and compact the cholesterol material up into the walls, and then allow the blood to flow through. And then a lot of times we'll put a metal tube called a stent, which is a tiny little metal device that looks like the inside of a ballpoint pen, that spring, and then it widens it open and acts as scaffolding to where the artery is open, and then we give medicines to thin the blood, to reduce the cholesterol, to treat the blood pressure, and that allows the artery to heal properly, and they do quite well with that.
How long a procedure is this, doctor?
It depends. We've actually done, from the time they got here to an open artery, in 13 minutes, which is the world's record. No one's done it faster. I beat the old record, which is 14 minutes. Which is my record as well.
Are you in the Guinness Book?
They haven't actually come by yet.
Maybe they will.
If they come by, I'm happy to show them. I have documentation of that, actually.
That's amazing.
Yeah, so we do it pretty fast. Sometimes it can be prolonged. The sicker the patient. See, the longer... Okay, the main thing is from the time the artery closes till we open the artery. That's called total ischemic time. Ischemic means there's no blood going to a part of the heart. And the goal is to make that as little as possible, okay? Now, if you come in like within an hour and we open your artery, you can walk out with a normal heart, and that does not shorten your life. The strength of your heart really depends on your longevity. Okay, the weaker your heart, the less you live. And if you come in late, let's say 12, 14 hours after you close the artery, the damage is done, and there's really not very much we can do about that. Okay, you just of course, treat them, and it usually shortens your life between 15 and 20 years. Like instead of living to 80, you might get to 60 or 55, but you're not going to go all the way, which is our goal.
What is the average? Is there an average age for patients?
The average age for people having a heart attack is 62 years old.
Oh my God!
Which is my age today.
Is it your birthday?
No.
Oh, but you're 62.
Yes, I am.
Wow.
But that's the average age in America.
Wow.
And probably throughout the world, I would imagine too.
Wow, that's interesting. What's the, I guess, just from exercise or lack of exercise as you get older, sedentary?
There's a lot of risk factors. There's risk factors you cannot change, like your age, your family history, ethnicity. These are all things that you can't change. But there's things you can: high blood pressure, diabetes, tobacco use, high cholesterol in your blood, high blood pressure. Those are things you can modify, modifiable risk factors. And that's how we treat someone with heart problems: is we modify their risk factors to where they have a less risk of having a heart attack. But, on the other hand, we want to let them know what to do when you're having a heart attack. Like I told you, the average amount of time is about an hour and 20 minutes, and nothing they've done. They've had videos, they've had, articles, all these things. Nothing has changed the amount of time it takes people to do that, which inspired me to do something unique that no one's done and entertaining to get them an idea of what you should do. So
when did you actually create that video?
2 years ago.
2 years ago.
I've had it in my mind for quite some time. But my daughter is a professional videographer.
Oh, so she shot it then?
Yeah, she shot it and
terrific.
edited it, and I just kind of wrote it and produced it.
Is that also her in the on the beach?
No, that's my other daughter.
Oh, it's your other daughter.
I have 4 daughters.
You have 4 daughters?
Yeah, and a son.
And you have 5 kids?
Yeah.
And you're still smiling.
So I wrote the screenplay, and then we just put it all together. And I wrote that song, Heart Attack Blues. I wrote that.
You wrote
song.
that?
Yeah.
Is that you playing on it too?
No, are you kidding? All I can do is unplug arteries really fast. That's all I can do. That's my only talent.
So who's actually playing on? I think there were some credits in the.
Yeah,
Is it a local musician?
A guy named what's his name? Jackson Allen. Jackson Allen. He's the guitar player. The singer is my son-in-law, Peter. He sings the song. And then I have guys that I know that have production companies that all help me.
So you put it all together.
Yeah, put it all together.
And how long did it take to create that? Because it's really well done.
About a year.
About a year, yeah. It's beautiful. And like I say, it was interesting to see Mike Herdman, which was sad.
I know, right?
But it's great because he lives on helping people.
Yeah. So. That was his best role, and he played himself, obviously.
Yeah, of course.
They do a lot. Our paramedics have really made a big difference.
They really have, haven't they? Arcadia is really got it down. I mean, you
We're the
guys
best.
really, you
No,
really
we're the
are.
best.
You
No,
really
no,
are.
There's no question. You know, all of LA County has modeled itself the way we've been doing things over the years. You know, we were the first to get the door-to-balloon time fast. We were the first to do that. You know, when they started doing EKGs in the field and then going to the heart attack center, we were, you know, totally involved with that. And then when they wind out of another hospital, we were the ones that implemented where you could call 911, pick them up at the other hospital, and then bring them over here.
Wow.
We started that program here at Methodist, and now all of LA County does it. Now what I'm trying to do is get them from that other hospital here faster.
Here faster.
So my poster, you know, shows, you know, what you do to get them out within 30 minutes. Because if
Right.
it's less than 30 minutes, there's a mortality benefit. You know, you save lives by doing that. If it's longer, then you don't.
So longer than 30 minutes,
Right.
yeah.
And the other thing I want them to do is call 911 earlier. You know,
Yeah.
so to recognize the symptoms. So I have my big poster that says typical and atypical symptoms.
Atypical.
You know, we're going to distribute that to all 70 emergency
Can you
rooms.
describe briefly some of the typical symptoms and then the
Typical
atypical?
symptoms is, you know, a man in his 60s, you know, having severe, you know, pressure in the chest, you know, going into the arm or the back, sweating, you know, being short of breath. They say, I feel like there's an elephant sitting on my chest. Those
Mhm.
are all, you know,
Right.
typical ones. But the problem is, most people don't, you know, present in a typical manner. You know, they present atypically. You know, a woman, let's say, having back pain, having jaw pain. I had one lady who kept having this jaw pain, so she went to her dentist, said nothing's wrong. You know, she went to her, you know, chiropractor, thought it was from the neck. So finally, someone sent her for a stress test, and this is like a 48-year-old, you know, kindergarten teacher.
Wow.
They got the stress test, and it was abnormal. They brought her to us here, and probably in this room, and it was about a 99% block in her bottom artery. So we unblocked that, put a stent in. It was totally atypical presentation.
Wow.
Yeah, women in heart disease are just a whole different type of person than, you know, men and stuff.
So it's more common in men, or is
It's
it?
about equal now. You know, men, you know, tend to get it younger. You know,
Mhm.
women are protected by their hormones until they go into menopause, and then
Mm.
they catch up. So like when they're in their late 40s, you know, the protective effects of the estrogens goes away, and then they start catching up. So they're about 10 years. Women usually in their 70s, you know, and 80s and stuff.
Oh, I see.
But
Okay.
the thing is, the mortality in women with clogged arteries is higher than with men. You know, they're older, they have more
Right.
other problems, you know, all those kinds of things, so that makes it worse. and stuff.
Is stress a contributing factor?
Yeah, absolutely. Very much so. We've had people that have had heart attacks without clogged arteries just from stress.
Stress
heart
of
attack.
work or family or
Well, you know, I had a
whatever.
cousin who's like 52, and this dog, it's really a pain. I hate that dog anyway. But anyway, it was a dog that it was a pain, so they kicked the dog out, okay? And then they felt guilty. The dog was trying to paw and then stuff, and they just ignored it, okay? So the next morning she goes out, and the dog is like dead in the pool, okay?
Oh,
And the
God.
dog is like an 80-pound dog. It's a big dog, and she's probably 110 pounds. So she's trying to get, she starts having pain, and she has, you know, bad chest pain, and she goes to the hospital. This is in Tarzana, where they live. And, you know, she's having a massive heart attack. And then they take her in, and they go in to unclog her arteries. She has totally normal arteries, but the front part of her heart is all blown out. It was a stress heart attack. It's called Takotsubo syndrome, after, you know, the guy who described it
Oh my
in
goodness.
Japan and stuff. So,
Wow.
yeah, stress totally contributes to it.
Well, this is amazing work you've been doing, and this video is you released it recently, right? And now it's on YouTube. And,
on YouTube,
you get
trying
quite
to-
a few views already. I've seen.
Only about 3,700.
Well, that's
you know,
not bad.
Katy Perry has 200 million hits. I don't know what she has that I don't, but there's something that I got to catch on to.
I love that. Well, thanks, Doctor. That's great.